हेलो। मैंने कुछ भी वो दिख नहीं रहा यूट्यूब के ऊपर ना, मैंने फोन पे खोल रखा है लिंक तो। ठीक है, एक मिनट। क्या कर दूं? अच्छा, ठीक है। हाँ, क्योंकि मुझे कुछ दिख नहीं रहा था उसमें। Hey everyone, I hope you can hear me and see me. So in today's class, actually, I'll be going to discuss some points of dental anatomy with you, and we'll start with the anteriors, the permanent anteriors. So today I thought to first cover the permanent anteriors, a little bit about these permanent anteriors, and then we'll go on to some points about the occlusion, and then maybe we'll have some MCQs. So let's start with the upper central incisor, the maxillary central incisor. So in front of you, you can see the maxillary central incisor in its different views. So labial, lingual, incisal, mesial, and distal. So more or less, this class will be a revision of certain points that we have studied in the class, right? So let's start with the labial view of the central incisor, or overall general features of the central incisor. So the first thing that you should notice here is that the crown to root ratio of maxillary central incisor, right? This is high. So crown to root ratio, it is high, and it is maximum amongst all. It is maximum amongst all anterior teeth. So all the anterior teeth, be it primary or be it permanent, maxillary permanent central incisor is the one which has highest crown to root ratio. So its crown is relatively longer as compared to its root length. Also, you would notice here that the root has no distal curvature, right? So this is the only anterior tooth which has no curvature in its root. There is no curvature. So this is the only tooth without any curvature in its root. And that is the reason in oral surgery, you will be taught that you can rotate this tooth while you are extracting, right? So no other tooth can be rotated while extraction except for maxillary permanent central incisor. So as I've just told you, crown to root ratio is maximum. The root has no bend. And also now let's go to the crown anatomy. As you can see, the crown, the distoincisal and the mesioincisal angles. The distoincisal and the mesioincisal angles, they are very sharp. And amongst the maxillary incisors, the central incisor has sharper incisal angles as compared to the lateral. Always remember that these proximo-incisal angles, that is mesioincisal or distal-incisal angles, they are sharper in central incisor as compared to the lateral incisor. So these angles are always sharper, and as you move backwards, as you move distally, these angles become more and more rounded. So you can compare them with the angles of the lateral incisor. So you will see that here the angles are more rounded, isn't it? So the central incisor has more sharp angles. Also, another thing that you would notice here is this lingual fossa, right? This lingual fossa, though it appears wider and though the cingulum is larger in comparison to the lateral incisor, you can see here that the cingulum is small and the lingual fossa is also small. Yet, which of the two do you think is more prominent? Now, when we are talking about prominence, it is not about the size, right? It is about which one appears deeper, right? Which one appears deeper, which cingulum appears more high or more prominent, and which fossa appears deeper, right? So in the lateral incisor, the fossa appears deeper, isn't it? You can see that in lateral incisor, fossa appears deeper. and hence the lateral incisor has a more prominent lingual fossa and a more prominent cingulum than central incisor. So cingulum and fossa, they are both more prominent on the lateral incisor as compared to the central incisor. Though the absolute size of the cingulum and fossa is more in the central incisor. As you can see, it has a larger cingulum, it has a larger fossa, yet they are not as prominent as the lateral incisor, right? Also, now look at its incisal view. Look at the incisal view of the central incisor. What you would notice is that the difference between the mesial and distal buccolingual dimensions. So this is the buccolingual or faciolingual dimension, right? This is the faciolingual dimension. Since it is the anterior, we will call it faciolingual or labiolingual dimension. So the labiolingual dimension on the distal side and on the mesial side are more or less same, isn't it? They are more or less same. But when you look at the same thing in the lateral incisor, what do you notice? Now here, this is the distal labiolingual and this is the mesial labiolingual. So what do you notice here? That the crown is thicker labiolingually on the mesial side as compared to the distal side, right? For the lateral incisor, the crown is thicker labiolingually on the mesial side as compared to the distal side, right? So the crown is thicker labiolingually on the mesial side. For which tooth? For the lateral incisor. As you can see here, there is a visible difference between the mesial and distal sides, right? But when you look at the central incisor, this difference is not noticeable, isn't it? This difference between the labiolingual dimensions of mesial and distal side is not very noticeable, isn't it? And let's go to the proximal or the mesial and distal view, right? So in the mesial view, the first thing that you would notice is this cervical curvature of the crown, right? This cervical curvature of the crown. So this cervical curvature is maximum of any tooth in human dentition. So be it anterior, be it posterior, be it primary, be it permanent, this cervical curvature on the mesial side of the maxillary permanent central incisor is maximum and its dimension is approximately 3.5 mm, right? So this is the maximum for any tooth in the human dentition. And compare it to the distal side, you would notice that this here it is shallow. So the general rule is that the cervical curvature is always more prominent on the mesial side as compared to the distal side of any tooth, right? So for any tooth, mesial is always more pronounced as compared to its distal side. The mesial curvature is always more pronounced as compared to the distal curvature, right? So other thing that you would notice on this proximal view is the position of the incisal edge. Now let's look at the position of the incisal edge. When you draw a bisector, right? When you draw a bisector that passes through the incisal edge and the apex, you would notice that this incisal edge is either on the apex or a little bit labial to the apex, right? So for maxillary anteriors, this is a general rule that the incisal edge is either on the apex or labial to it, right? It is either on the apex or it is labial to the apex. Clear? So the apex is either bisected by the position of the incisal edge or it is labial to the apex. The other thing that you would notice here is the thickness of the crown on the proximal view. The thickness of the crown on the proximal view. Right? So you can notice here that the thickness of the crown on the proximal view is greater from the distal view, right? The thickness of the crown, this thickness of the crown is greater on distal side, right? It is greater on the distal side as compared to the mesial side. Why is that? Because every tooth, as we go from anterior to posterior, so moving distally, the crowns have a distal tilt, isn't it? They have a distal twist. These crowns or these teeth twist distally, and hence more of labial surface is visible from the distal side, right? As you can see here in this diagram, right? Let me delete this. As you can see here in this diagram, labial surface, more of labial surface is visible from the distal view as compared to the mesial view, where minimal or no labial surface is visible. And that is the reason the thickness of crown appears greater on the distal view as compared to the mesial view. So the crown is not really thick on the distal side. It's just that its position makes it appear thicker, right? So if there is anything that you would like to ask, you can ask me, or we can move to the lateral incisor. Also notice one more thing here. The crest of curvature. The crest of curvature on the proximal side, that is the maximum convexity on the proximal surfaces. On the anterior, on the central incisor, on the mesial side, and on the distal side are both in the incisal 1/3, isn't it? The maximum convexity of this crown or the maximum dimension of this crown is in the incisal 1/3. But as we move backwards, this maximum convexity goes towards the cervical margin. So its position goes more apical as we move towards the lateral incisor to canine to premolars to molars, right? So let's go to the lateral incisor. Lateral incisor, some parts we have already discussed, but as you can see in this labial view, the root has a distal curvature, isn't it? The root has a distal curvature. Also, it has a slight labial bend, isn't it? The root also has a slight labial bend. So the root bends both in the labial and in the distal directions, right? And as you can see here, the crest of curvature on the maxillary lateral incisor distal side has migrated towards the cervical margin of the crown, isn't it? It has migrated a little bit towards the cervical margin. The crest of curvature is a bit lower as compared to the central incisor. As we have already discussed, these angles, the distoincisal and the mesoincisal angles, they have become more rounded, isn't it? Also not seen in this diagram, but present is a palatogingival groove, right? So sometimes this palatogingival groove is also present on the palatal side of the lateral incisor, and this is a unique feature which is present only in the upper lateral incisor, right? So this is a unique feature. And what type of groove is it? Is it a supplemental groove or a developmental groove? You know what supplemental groove is, right? We have seen it in the class. Supplemental groove is something that separates two developmental lobes, right? We know that all the teeth, they are made up of multiple lobes, isn't it? The anteriors are made up of 4 lobes, isn't it? 3 labial lobes and 1 lingual or palatal lobe, right? So the junction or the confluence of these lobes is seen as grooves. So these grooves, which represent the confluence or the junction of these lobes, are known as supplemental grooves, and any other developmental groove, and any other groove is known as supplemental groove. So this palatogingival groove is a supplemental groove, right? So this palatogingival groove is the supplemental groove. Again, you would notice here, as we have just discussed, the fossa and the cingulum are more prominent as compared to the central incisor. You would notice the difference between the sizes of the crown and root. The crown to root ratio is definitely lower as compared to the central incisor. So we have already discussed that the central incisor is the only tooth which has the maximum crown to root ratio, right? You can simply say it has the maximum crown to root ratio amongst all the anterior teeth. Now in the proximal view, again, as you can see, the cervical curvature, the curvature of the cervical line is more prominent on the mesial side as compared to the distal side, right? And as we have seen in the central incisor, again, more of labial surface is visible from the distal view. So more of labial surface is visible from the distal view, right? Also, in the central incisor, there were no developmental depressions on the root, but in lateral incisor, for the first time, we can see a developmental depression, right? For the first time, you can see a developmental depression. So look at the proximal views. You can notice a slight depression here, right? You can notice a slight depression here, isn't it? So lateral incisor has a depression on the distal side. It may or may not have a depression on the mesial side. So here it may or may not be present, but it definitely has a depression on the distal side. Also, we have discussed about the labiolingual dimensions on the mesial and distal half of the crown, and we know that it is greater on the mesial half as compared to the distal half, right? So you can say that the crown is constricted on the distal side, right? The crown appears constricted on the distal side. So the crown appears constricted on the distal side, isn't it? The crown appears constricted on the distal side. Also, from the incisal view, you can see a prominent cingulum. The cingulum is more prominent as compared to the central incisor, isn't it? And if someone asks you about the shape of the tooth, from the incisal view, what you would say is it appears triangular, right? It appears triangular. We will not consider the this prominence created by the cervical margin of the labial surface, right? This prominence is created by the cervical portion of the labial surface, or you can say cervical ridge, right? So we don't consider it as the outline of the occlusal or the incisal surface. The incisal outline in any case would be said to be triangular, right? Triangular. Let's go to the central incisor of the mandible, or the mandibular central incisor. Again, you can see that even the mandibular central incisor has a distal curvature, right? The root has a distal curvature, and this is the most symmetrical crown. So of all the teeth in the human dentition, be it primary or permanent, the mandibular central incisor is the most symmetrical crown. I'm not talking about the tooth. It is the crown that is most symmetrical, right? You can easily identify the root because it has a distal curvature, right? So it does not have a bilateral symmetry. It is the crown that has a bilateral symmetry. And this is the only tooth which has its mesioincisal and distoincisal angles at the same level, right? The mesioincisal and distoincisal angles are at same level at the incisal edge, right? So these angles are at the same level and they are at the incisal edge, not in the incisor third, but at the incisal edge, right at the incisor, right? So it's a crest of curvature or the maximum convexity lies at the incisal edge and is at the same level. It is at the same level. Also, you would notice same as maxillary anteriors, this tooth also has a lingual fossa and a cingulum, but the lingual fossa and cingulum of the central incisor as compared to that of lateral incisor, mandibular lateral incisor is shallow, right? So the lingual fossa of the mandibular lateral incisor is more prominent as compared to this mandibular central incisor. The difference between the maxillary and mandibular incisors is that the maxillary central incisor was larger than the maxillary lateral, whereas in mandible it is the lateral incisor, which is larger than the central incisor, and again it is the lateral incisor which has more prominent lingual fossa and cingulum, right? So though it is larger, it yet has more prominent cingulum and fossa, right? So amongst the incisor, amongst the permanent incisor, which incisor has the least prominent cingulum or least prominent lingual surface? Answer would be lower central incisor, isn't it? And when you are asked which incisor, which permanent incisor has the most prominent lingual anatomy, then it would be maxillary lateral incisor, right? Its fossa is more prominent than the mandibular lateral incisor. So if we were to write it down in a series, we would say that maxillary lateral incisor has most prominent lingual anatomy, followed by mandibular lateral, followed by upper central, and the least prominent would be mandibular central incisor, right? Its lingual surface is more or less smooth, right? The lingual surface is more or less smooth. Is it clear? Also, you would notice that since it is the most symmetrical tooth, its cingulum is in center mesiodistally. So it is neither mesially located nor distally located, it is centered, right? It is centered mesiodistally. Also, we can confirm this from the labial view, from the incisal view, it is centered mesiodistally, right? Again, as we have talked before, the cervical curvature of the curvature of the cervical line, it is more prominent on the mesial side as compared to the distal side. And unlike maxillary incisors, here the developmental depression on the root is present both mesially and distally, right? So in the upper central it was not present, in upper lateral, on the distal, in lower incisors it will be found on both mesial and distal sides. Also, another thing that you would notice is, as we have talked about the position of the incisal edge compared to the apex, you would see that here the apex is labial to the incisal edge, or you can say the incisal edge is lingual to the apex. So unlike maxillary, where the incisal edge was on the apex or labial to the apex, in the mandible the incisal edge is lingual to the apex for all the anteriors. So incisors and canines, they both will have a lingual edge. Let's go to the laterals. Laterals, when you compare them to central, as I just told you, they are larger, their features are more prominent, it is not as symmetrical as the lateral incisor. So you would notice that the disto-incisal angle is a bit rounded, right? It is a bit rounded as compared to the central incisor, right? Also, you would notice a slight deviation of cingulum to the distal side. So cingulum is slightly deviated to the distal side. Apart from that, there are no other features of notice, right? So let's go to the next tooth, the maxillary canine. The maxillary canine is the largest anterior tooth, right? This is the largest anterior tooth, and it has the longest crown, longest root, right? It has the longest root. The longest crown is of the mandibular canine, right? The longest crown is of the mandibular canine. This has longest crown. So maxillary canine, this is the largest anterior tooth. Also, it has the most prominent lingual anatomy, right? The cingulum and the lingual fossae, they are more prominent on the canines. Also, remember as a general rule, as you studied in the class, the mesial crown ridge, the mesial cusp ridge is shorter as compared to the distal cusp ridge, right? Mesial cusp ridge is shorter than the distal cusp ridge, right? And as you can see, the distal crest of curvature is more apical as compared to the mesial crest of curvature. And as we move distally, the same thing continues. On a tooth also, the mesial crest of curvature is higher as compared to the distal crest of curvature, right? So there is not much about this tooth. The important things we have already done in the class. Apart from that, what was remaining, I just told you. Also, now let's see in this mandibular canine. Notice that here the mesial margin or the mesial border of this tooth appears almost like a straight line. So this tooth, its mesial border is almost a straight line. And also this tooth is a fusion of premolar and incisor. Why? Because look at its mesial cusp ridge. It's more or less straight, whereas the distal cusp ridge has an angulation or a incline, right? So its mesial half resembles like an incisor, whereas the distal half resembles like a premolar or a posterior tooth. So you can say this tooth has features of both anterior and posterior teeth, right? Right, same as the teeth we have studied before. The distal crest of curvature is a bit apical as compared to the mesial crest of curvature. Its lingual anatomy is less prominent as compared to the maxillary canine, right? The root has a distal curvature, and when you look at its crown, you can see the cingulum has a visible distal tilt. Right, the cingulum has a visible distal tilt. So which teeth have a cingulum with distal tilt and which teeth have cingulum that is centered mesiodistally? So lower one, upper two, upper three, these have a centered cingulum, whereas upper one, lower two, lower three, the cingulums are distally deviated, right? The cingulums are distally deviated. Again, one more thing that you must remember is that the labial outline, this labial outline, it roughly resembles the letter C, right? It roughly resembles the letter C. So this is one of the points which may or may not come as an MCQ. Just remember it, that the labial outline, it roughly resembles like a C. Clear? So let's go to the next point. This we have covered in the class, yet here I have included it just for the practice. So basically, this is the picture of a child who has suffered from or who was administered tetracycline. So now he's suffering from tetracycline staining, right? So you may be asked, when did the tetracycline drug was administered and when was it stopped, right? At what age the tetracycline drug was given? So just remember, always remember that we will always take this central incisor as the reference, right? This is going to solve all your questions as we have discussed in the class. So just remember that it starts to form at around 5 months of age. That's we have studied 4 to 5 months of age. So roughly for solving this question, always remember we will take it as 6 months, right, to make it easy for ourselves. And it completes at about 5 years. So you have roughly 4.5 years of duration between its initiation and its completion. So we can say that this entire crown formed in 4.5 years. So we can easily divide it in 3 parts of 1.5 year each, right? All these 3 parts will be of 1.5 years each. So if it starts at 6 months, then the first line, this represents when the tetracycline staining has initiated. So by luck, it has coincided with the first mark, right? So this first mark would be at 1.5 years from the inception. So 6 plus 1.5, that would be 2 years, right? So 6, it started at 6 months, and 1.5 years later, the drug was administered. So approximately 2 years, that would be the age when the tetracycline administration was begin, right? When the tetracycline administration was started, right? As you can see, this line, as you can see, this first line, it almost coincides with the initiation of the drug, right? So we can roughly say that this was the time when the drug was given first, and this line is 1.5 years from the initiation of the tooth. Initiation is at 6 months. So 1.5 year plus 6 months, that would be 2 years. That is the time when the drug was first administered to this child. Is it clear? So that's how you can solve such questions. Now let's say this line was somewhere here. Let's say this tetracycline staining started somewhere here from the middle part of this tooth. Then we can clearly say it started somewhere between 2 and 3.5 years of age. So even then, you can further localize it. If it was in the center, then maybe at 2.5 or 3 years of age, right? So that's how you can solve such questions. And since it is a time-related disturbance, right? Isn't it a time-related disturbance? Because tetracycline was given at 2 years of age, and for a limited period, it caused staining, and this staining is seen in all the teeth. So that's why this is sometimes referred to as temporal hypoplasia, right? Temporal because time related, isn't it? So temporal hypoplasia, that is what it is sometimes known as. So this diagram I had included to tell you something about the differences between the primary and the permanent. Just to revise, we have studied it in the class, but we can again revise it, right? So let's start with the crown. As you can see, the crown of the deciduous is smaller as compared to the permanent, and the crown to root ratio is also greater for permanent as compared to the primary, right? Whereas the roots they appear longer in the primary, isn't it? The roots appear longer in the primary. The crowns appear larger in permanent. You can see the thickness of enamel is more or less uniform in the primary, whereas it is variable in the permanent, isn't it? Maximum at the cusp here, about 2.5 mm, whereas here it is more or less 1.5 mm, isn't it? So the thickness of enamel is more or less constant in the deciduous, whereas it is variable in the permanent. The other thing that you would notice is the pulp is closer to the surface, whereas here the pulp is deeper. It is smaller. Here the pulp is smaller. Here the pulp is larger. Right? The roots are thin. Here the roots appear thick. Right? Here the roots appear slender. They appear thin. But in permanent, they would appear thick. They would appear shorter. So they are thick, but they appear short. Is it clear? Also, another striking feature that you would notice is this cervical dip, which is seen just beneath the cervical curvature of the crown. So just beneath the cervical curvature, you will have this cervical dip that is seen in the primaries, whereas in the permanent, this cervical curvature is not as prominent, and therefore the constriction here is not as prominent, isn't it? Since the curvature is not prominent in permanent teeth, the constriction just beneath the curvature is also not as prominent. So this cervical curvature and the resulting constriction are more prominent on the primary teeth. And even in primary, they are more prominent on the posteriors, that is on the molars. So this is a diagram for the various types of cusps. For various types of cusps and occlusion. So first one represents a haplodont or a single conical tooth. A tooth with single conical cusp, a haplodont. Right? It represents a tooth with single conical cusp or a haplodont. So you can see, if at all such a diagram is asked, you can straightforward say that this is a haplodont or a single conical cusp tooth. These solid ones represent maxillary and these circles represent mandibular. In the next diagram, you can see this diagram represents a bigger central cusp and a smaller and two smaller mesial and distal cusps, right? So there are three cusps and they are arranged in a line, right? What does this diagram represent? There are three cusps. The central one is larger and they are arranged in a line. So this will be known as triconodont. Triconodont, it has three cusps and these cusps are arranged in a line. So this is how they would occlude. The third diagram, this third diagram, you can see that we have a larger central cusp and two smaller mesial and distal cusps, but these cusps are not arranged in a line, right? These cusps are not arranged in a line. Rather, we have one lingual and two buccal cusps, isn't it? We have one lingual and two buccal cusps. So these are known as tritubercular cusp, teeth, right? These are known as tritubercular teeth. And again, the solid ones represent the maxillary teeth and the circles represent the mandibular teeth. And the human teeth that are derived from these tritubercular teeth are maxillary molars, right? So maxillary molars are derived from the tritubercular teeth. Whereas in the last diagram, you can see here that the maxillary teeth are tritubercular, whereas the mandibular teeth, as you can see, it has 1, 2, 3 and 4 cusps, isn't it? So the mandibular tooth is quadritubercular, right? The mandibular tooth is quadritubercular, whereas the maxillary tooth is tritubercular. And quadritubercular teeth, as we can see here, gave rise to the or developed into the mandibular molars, right? They developed into the mandibular molars. So these teeth that developed into the mandibular molar or the maxillary molar, these cusps will be known as the primary cusps. So in maxillary, these cusps would be both the buccal and the mesiopalatal, right? So in maxillary molar, the primary cusps would be both the buccal and mesiopalatal. So these three cusps are the primary cusps, and hence you can see that they form a triangle, right? They form a triangle, and these cusps, that is mesiobuccal, distobuccal, and mesiopalatal, they form the primary cusp triangle in the maxillary molar. Whereas the mandibular molar, as you can see, they have all the four cusps, that is mesiobuccal, distobuccal, mesiopalatal, distopalatal, right? So there is no primary cusp triangle, right? Let's go to the next topic. These are the proximal contacts, right? These are the proximal contacts. Now, as I have given you a hint when we're talking about the anteriors, that the maximum crest of curvature is more towards the incisal edge in the central incisor, but as we move distally, this crest of curvature goes towards the apex or shift towards the apex. So what happens is, when the teeth they first erupt, right? When the teeth they first erupt, they will have a point contact with each other, right? This is a point contact. So the proximal contact is point contact initially, but with the age, what happens is this will undergo attrition, right? This will undergo attrition, and this point contact will eventually change into area contact. So with age, the point contact changes into the area contact, and this point contact, as you can see in the incisors, is more towards the incisal edge. But as we move posteriorly, as we move distally, this shifts, this area shifts more and more apically. So as you can see in the molars, it is in the middle third, and even in the middle third, it is closer to the lower third, right? It is closer to the lower or the apical part. It is closer to the lower or the apical third, isn't it? So you can remember this as a general rule. Now here, this is a part of the occlusion. And what does this diagram say? Here in this diagram, you can see a mandibular, molar and a maxillary molar. So sometimes they might ask you the movement of one over the other. So let's say if I asked you in which direction would the maxillary molar move on a mandibular molar in a protrusive movement, right? So movement of maxillary molar, right? Movement of maxillary molar over mandibular molar in protrusive movement. So in what direction would the maxillary molar move in a protrusive movement? So let's say my this upper hand represents the maxilla, and lower hand represents the mandible. So in a protrusive movement, the maxilla relatively moves distally, isn't it? So the answer would be that in this protrusive movement, the maxillary molar moves distally, isn't it? So as you can see here in this diagram, the arrow that is pointed distally represents the protrusion, isn't it? Protrusion. So in protrusion, the maxilla will move distally, and this arrow actually is representing the movement of the mandibular molar, isn't it? It represents the movement of mandibular molar. And as you can see here, the maxillary molar over the mandibular molar moves in a distal direction, right? So basically this arrow represents what direction the opposing tooth will take on them. So similarly, in a working side movement, the maxilla will exit towards the lingual side, right? The maxilla will exit towards the lingual side, whereas the mandible would exit from the buccal side, isn't it? So this is the buccal, this is the lingual. In a working side movement, the mandible will exit towards the buccal side of the maxilla, and maxilla relatively, it appears to move towards the lingual side, isn't it? So that is what these diagrams represent. So maybe you can remember them to remember the relative movement of maxilla and mandible over each other. So now we have some questions. So the first question is related to forensics. So which of the two teeth shown is younger? So amongst these two teeth, this is the tooth A, this is the tooth B. Which one do you think is younger? Right? Which one do you think is younger? So first of all, let's look at the thickness of the enamel. Let's look at the thickness of the enamel. Right? In the option A, the thickness is greater, right? Enamel is thicker. More in A, right? Then let's take a look at the pulp. Pulp also, pulp chamber and canal, they are larger in A as compared to B. Then let's take a look at the thickness of the cementum, right? Thickness of the cementum. So cementum is thicker in B as compared to A. So enamel is thick in A, that means there is less wear. Pulp chamber is larger in A, that means secondary dentine formation is less. Cementum is less in A, That means not enough time has passed for more of cementum to deposit, right? Or the secondary cementum deposition is less. So all of these features point out towards a younger tooth, which is the A, isn't it? So A is the younger tooth. A is the younger tooth because it has more enamel, less of secondary dentine, less of secondary cementum. Yes, very good, Bhavna. So the answer is option A, right? So let's go to the next question. Which of the following can be easily calculated from the diagram? So from this diagram, what can be easily calculated? दांत को सीधा कर लेते हैं पहले ना, थोड़ा सीधा सा डायग्राम बना लेते हैं. So let's say this is the crown, this is the root, and what do we need to calculate? Clinical crown, anatomic crown, age of patient, pulp volume. So obviously you cannot calculate pulp volume from this diagram itself. It's a 2D diagram, isn't it? So we cannot calculate the pulp volume from a 2D diagram. So pulp volume is crossed out. Age of the patient, again we can calculate. It's a fully formed tooth. The patient could be of any age, isn't it? So what's left is clinical crown and anatomic root. What is a clinical crown or a clinical root? And anatomic crown and anatomic. So in this diagram, we can clearly say that this is the cement to enamel junction. So anything above this has to be the crown. Anything below this has to be the root. So this is the definition of anatomic root and anatomic crown, isn't it? So this portion from CEJ to the apex is anatomic root, and this portion is the anatomic crown. So from this diagram, we can clearly say that we can calculate the length of the anatomic root or the anatomic crown. But what is the clinical crown? So let's say the crown is still in the oral cavity, it is still in the mouth, still in the jaw, isn't it? And all you can see is the part of the tooth that is erupted in the oral cavity, isn't it? So whatever part is erupted or is seen in the oral cavity, that is clinical crown. So if the crown has not yet completely erupted, let's say the CEJ is still within the gingiva, then whatever is visible, that is the clinical crown. So root would be more longer, isn't it? And whatever is invisible, whatever is within the bone or within the gingiva, right? That part is known as clinical root. So with age, as the tooth erupts into the oral cavity, be it supra eruption or post eruptive movement, whatever it is, as the tooth keeps on erupting, the clinical crown will appear more and more, and the clinical root will reduce, isn't it? Let's say initially this much crown was visible, and the remainder of the crown was inside the bone or the gingiva. Then the clinical root was longer and the clinical crown was shorter. But with age, the gingiva will recede, the tooth will erupt, so the dimension of the clinical crown will increase and the clinical root will decrease with age. Is it clear? The difference between clinical crown and anatomic crown. Clinical root and anatomic. Whatever is visible in the oral cavity is clinical crown. Whatever is invisible or not seen is clinical root. Clear? Next, this is a question from occlusion. So, in a patient with canine guided occlusion, metal crown was placed and occlusion was checked with the articulating paper. Contacts were ideal in centric occlusion. So centric occlusion में contacts are ideal, right? But showed a smudge mark. This is smudge mark in the lateral jaw movement. So lateral jaw movement means working side. There was a smudge mark on the working side. Identify the contact represented by the smudge mark. So what type of contact does this smudge mark represent? So let's go to the options. Option A is working side, non-working side, protrusive and retrusive. So as the question itself has said, what does it say? the mark is produced in the lateral jaw movement. Lateral jaw movement itself is the working side movement. So the question is itself providing you the answer. तो अगर आप ढंग से पढ़ोगे तो आपको आंसर क्वेश्चन के अंदर ही मिल जाएगा. In the lateral jaw movement, there is the smudge mark produced. So identify the contact represented by the smudge mark. It is the working side, isn't it? It is the working side movement. Is it clear? So these are the simple questions where the answer is provided within the question. Now let's go to the next question, which is a continuation of this or which again depends on this first diagram. So identify the tooth which caused the smudge mark on the diagram in last question. So which tooth? Which tooth caused this smudge mark? ये smudge mark कौन से tooth की वजह से पड़ा? So obviously this is the mandibular tooth, as you can see. Distal cusp, distobuccal and mesiobuccal cusp, isn't it? So this is the mandibular first molar, and opposing it would be the maxillary first molar. But which one, right or the left? So as you can see from this diagram, right, as you can see from this diagram, which tooth do you think it is? Is it the left mandibular first molar or the right mandibular first molar? Remember, this is the distal side, mesial, lingual and buccal side, isn't it? So if you reorient it, you would realize that it belongs to the right quadrant, isn't it? And opposing it would be maxillary right first molar. Clear? So the answer to this second question would be maxillary right first question. So whenever you are asked to identify it, first of all, orient it or mark its different sides, lingual, mesial, distal, buccal, and try to orient it into your own mouth or into your own oral cavity, and you would realize to which quadrant does that tooth belong, right? Identify the maxillary permanent right central incisor. So maxillary permanent right central incisor, isn't it? So which of these is the maxillary permanent right central incisor? Let's say this is the mesial and this is the distal. As you can see, this is the sharper of the two. Again, this is the sharper side, mesial, distal, but this is the lingual side, this is the labial side. This one and this one, they both appear to be central incisor or lateral incisor. Do they look like central or lateral? So first of all, let's rule out option C and D. These are lateral incisors, not central incisor. So now we are confused between A and B. Which of these two is the maxillary permanent right central incisor? Now we are concerned about the right, the left. Clear? So again, you can position them into your own oral cavity. Try to position them. This is the second diagram. Lingual side, the lingual view, mesial on your right, distal on your left. Do you think this is the right or the left central incisor? If you position it in your own oral cavity, you would find that this is the left central incisor, and the correct answer is option A, isn't it? The correct answer is option A. This is your maxillary right central incisor, isn't it? Identify the tooth shown. So one thing is clear, that this is a maxillary molar, isn't it? This is a maxillary molar. Then you can identify a large cusp and a small cusp. So larger cusp has to be mesial. Again, you can see a large mesial cusp, right? The large mesiopalatal cusp can be seen from the buccal side. So this has to be the mesial side and this has to be the distal side. Again, you can confirm it by the size of the roots. The mesial root is larger as compared to the distal root, isn't it? So we have identified the jaw, we have identified the mesial and distal sides. Now all you need to do is reorient it so that mesial faces forward, distal faces backwards. The buccal should face outwards, isn't it? So if you reorient it, you would realize that it again belongs to the right quadrant. Now let's say if you wanted to reorient it to the left side, what would happen? This is the buccal view, isn't it? This is the buccal view. So if you wanted to reorient it towards your left side, either the buccal surface you will find is facing the palatal side, or if you twist it, you would find that the mesial side goes towards the distal side, isn't it? So in any case, the tooth won't fit your left side. It will only align with your right quadrant, and hence we would say this is the upper right first molar, isn't it? This is the upper right first molar. Is it clear? Option B, upper right first molar. So let's go to the next question, and this is the last question. Erupted teeth in the oral cavity of a child are shown in figure 14. What is the approximate age of the child? So these are all deciduous teeth and these are the permanent teeth. First molars erupt at the age of 6. So definitely child is 6 years of age. At least 6 years age का तो है ही है. Then we have the central incisor and the lateral incisor. So amongst these four, the maxillary lateral incisor is the last to erupt, isn't it? It is the last to erupt, and at an age of 8 to 9 years. It erupts at an age of 8 to 9 years. So definitely this child is at least 8 years old, isn't it? This child is at least 8 years old. He may or may not be, or this child may or may not be 9 years of age, क्योंकि 8 से 9 रेंज है, तो कम से कम 8 का तो हो ही गया है, isn't it? कम से कम 8 का तो हो ही गया है. So at least 8 years of age child ही है. सिमिलर क्वेश्चन एक और देख लेते हैं कंफर्म करने के लिए. So this is again a similar question. What do you think is the age of this child? तो पिछले वाले में तो हमने ऑलरेडी आंसर लिख रखा था, इस वाले में आंसर नहीं है. You have to identify the age of the child. So what will we notice here? We still have all the deciduous teeth, isn't it? We still have all primary teeth, right? But permanent first molars have erupted, isn't it? Permanent first molars have erupted. So ये child जो है ये at least 6 years का तो है ही है, because the permanent first molars have erupted, isn't it? So that's why we can easily say that this child is at least 6 years of age. अगर lower central भी erupt हो जाता, which erupts at an age of approximately 7 years of age, you can say approximately 7 years of age, then you could have said that the child is 7 years of age. But since they are still in the process of eruption, right, the lower central incisor has still not exfoliated, so the child has not completed 7 years of age, we can say, and hence the answer would be 6 years of age. Simply इसको भी देखोगे मोलर को तो भी कह सकते हो कि परमानेंट टूथ एक ही इरप्ट हुआ है, that is the upper and lower first molars, isn't it? Upper and lower first, they erupt at an age of about 6 years. That's why this the child is at least 6 years of age. 8 years का है या नहीं हमें नहीं पता, but 6 साल का तो है ही है, पक्का है, right? So the answer is C, 6 years of age. So that is all for today. I hope you got to learn something new. If there is any doubt, you can ask, or is there any doubt that you would like to ask? तो फिर क्लास बंद करते हैं, ठीक है? अगर कोई डाउट हो अभी है तो आप अभी पूछ सकते हो, अगर अभी नहीं है बाद में आता है तो कैन मैसेज मी, राइट? टेक केयर, गुड नाइट.